So, good morning or good afternoon, everybody. Welcome to this webinar where we're launching and explaining the Digital Health and Discovery Platform Innovation Fund, which we launched on our website, dhgp.ca, a couple of weeks ago. And hopefully, we'll show you some background to DHDP, what the Digital Health and Innovation Fund is all about, and also entertain questions and answers at the end of it. I'm Jim Woodgate. I'm the President and Scientific Director of the Terry Fox Research Institute, which is overseeing the Digital Health and Discovery Platform. And if you go to the next slide, please, Ashley. Just a note that we are recording this, and we're going to publish it on the website at dhgp.ca following today's webinar. And on that site, if you noted, this is the top of the website, the dhgp.ca website. We'll also be posting a FAQ there and updating that FAQ with the questions that we received today from the audience. Next slide, please. So we're going to split this up into about half an hour of explanation and then this Q&A period. So we'll start off with the background of what DHDP is, and then I'll turn over to Ashley and Ethan, who will introduce themselves and talk about the Digital Health Innovation Fund. Next slide, please. Next slide. So I'm going to skip through these pretty quickly because we want to give as much time as possible for questions and answers. But this is the DHDP, as we call it, is an initiative led by the Terry Fox Research Institute, which is based in Vancouver, as well as 50 partners across Canada. It's funded through the DHIF, the Strategic Innovation Fund Stream 4, to the tune of $49 million from ICED, a government ministry for innovation, science, and economic development. But that also has to be matched with external funding. And as you'll see, the Digital Health Innovation Fund represents about half of that funding. And its intent is to support both the public and private sectors in collaborating to accelerate the ability to commercialize and innovate and discover new research findings. And as you'll see, it's very much focused on AI, machine learning, and obviously in the health sector. So next slide, please. So the mission of DHDP is really to help to accelerate the adoption of precision medicine in a variety of disorders. We're starting off with a particular focus in cancer and neurodegeneration, but we are not excluding by any means other health research domains. And it's a Canadian enterprise, and it's, as I mentioned before, it's really meant to encourage the application of large data sets and AI. This aligns with our own mission, the Terry Fox Research Institute. We started actually in 2007, but have been funded through the Terry Fox Foundation in supporting cancer research since for almost well over 40 years. And we support a number of different programs, including program projects, which involves a number of teams across the country working on cancer research. But as I mentioned, the Digital Health and Discovery Platform is not meant to be only focused on cancer, and it's actually meant to be disease agnostic. So the current project, which we have funding from ICED, it runs until March of 2027, and there's potential for an extension, but we're not counting on that by any means. So this is a brief timeline of where we stand. Actually, the project was launched before this timeline shows, but we underwent a reorganization and generated some new partners in 2022, which include Bitnobi, which is now part of Myant, as well as Integrate AI, which is a artificial intelligence group which is based in Toronto. And also we have an open source partner, Candig, which has been working, it's based at the University Health Network in Toronto, and has been working with us on a number of projects, including open source federated querying. So we actually it took a while to get approval for these new partners, which occurred just over a year and 2 months or 3 months ago. And so we then launched this program, and it's a little bit different than it was originally. This is very much now a cloud-based system. There's no new hardware involved. And you'll hear about that a little bit from Ashley and Ethan. So our priorities really are to build this platform, but we want to do it not in a sort of build it and they will come type of format, but rather in collaboration with potential users and also data generators to ensure that we're providing solutions as it acts as a true platform for Canadian researchers, companies, and other entities. The real thrust around this and the interest from ICED is to help to commercialize and innovate around big data, especially in the health sector, because as we know, it can be very, very difficult to access health data. And so the reasons for that is that it's, as I'll come on to in a second, a sort of multi-variant, and we hope this, we intend this design of this platform to solve some of those issues. And of course, we're also looking for sustainability in the longer term. This is a brief structure, governance structure. So we're funded through ICED, as I mentioned. The program is operated by Terry Fox Research Institute staff who are actually located across the country. We get oversight from the Terry Fox Research Institute board, and we also have an independent executive committee, and they help us with strategic guidance, making and financial oversight, for example. And we also then have a number of external working groups and committees, which have been developing a number of policies and procedures, many of which are actually on the DHDP.ca website. And we also are working with various technical partners, which I mentioned before, in the development of the platform. Next slide, please. So our mission, should we choose to accept it, which we did, is to accelerate the adoption of precision medicine in general. And I won't really focus on what precision medicine is about. Obviously, it's through the benefits of understanding that individuals and their genetic makeup and combined with the external exposures mean that they will respond to different therapies in different ways. And it's about finding the right drug or the right therapeutic for the right patient, which requires you to do a number of different types of profiling, such as DNA sequencing, but many other approaches as well, and to then combine that information and identify those patients who are going to be are likely to respond to those particular targeted therapies. And again, oncology has been an area where this has been very much driven in terms of new therapeutics, a lot of very targeted therapeutics with reduced side effects, but it applies to many other types of disease and disorders. So we're really trying to accelerate this because precision medicine requires this large amount of data and to analyze that data in order to understand where particular subgroups of patients may benefit. Go to the next slide, please. So I alluded to this just a couple of minutes ago. One of the biggest problems, I think, with data sharing in the healthcare sector is that the data, although the data is actually owned by patients, it's under the custody of and stewardship of the health institutions, notably the hospitals. And for them, they have to protect that data from being breached, and we've heard all sorts of horror stories around that. And also, of course, for them, their major business is their major function is to make people healthy, and not necessarily to be supporting research. And so we have to make it as easy as possible for them to come together and to be able to allow that data to be shared. And the patients expect this, and we work with a lot of patient groups. So the patients very much want to share their data, the vast majority, but right at the current status, it's very, very difficult. So DHCP was built from the ground up around data privacy, and we also provide the data access to the control of data access to the generators of that data. So users apply to be able to access the network and the platform to be able to share that data, but that falls under the control of the actual data generators. And that situation means builds trust with the data generators who do have an obligation to share, but don't have very easy methods to do that. And then, of course, we've got data pre-processing and quality control and all those sorts of things which have to be worked out. To achieve this mission, we're trying to foster this network effect. As I mentioned, we're building the platform and we're doing it in concert with data generators and with data users. And so it's meant to be enabling data sharing, but not necessarily by the only mechanisms that we can come up with. I will think about it's we're very much open to the ideas of various external partners, and that's what the Innovation Fund's all about. The network effect really is to help to start this, get a kickstart, to be introducing more and more institutions and more potential users in understanding the benefits of sharing of data. And of course, it's because it's funded from the federal government. It really is intended to try to again mobilize our knowledge economy. So we're going to go into some of the details. The roadmap includes this multimodal data, different types of data, genomic data, clinical data, imaging data, for example. And again, it's targeting a number of different health research areas with an initial focus on oncology and neurology, but we are very much open to great ideas and data sources in other research domains. Next slide. And of course, it's sort of alluding to this before, precision oncology, as I mentioned, precision medicine requires a lot of data, and analyzing that data is not so trivial, but there's an emerging and amazing new innovations in the field of AI, and we feel that this is going to have a massively accelerating effect in terms of understanding the various complexities associated with human disease. And so this is why DHCP is intended to be machine learning friendly and really organized around being able to analyze and access data. So for the next few slides, I'm going to hand it back to Ashley and to Ethan for the technical framework.
Thanks, Jim. So I'll dive right into the technical framework. At its core, DHCP is a technology, or in other words, a privacy-first data sharing platform, is being designed to allow users to discover, prepare, and analyze. Discover in terms of finding relevant data relevant to the user's research, preparing data under certain governance controls before sharing, and analyzing the data with data science and machine learning use cases. And the DHCP adopts a privacy by design approach through federated distribution of data, the enabling of privacy-enhancing technologies like federated learning, compliance with industry standards, and by providing data providers with the technological parameters to allow them to set various levels of access, for example, user-based or time-bound access. And we also guide our strategic approach with best practices, namely OMOP, the Common Data Model, which I will go over briefly in a couple of slides, and the FAIR principles. FAIR stands for making data findable, accessible, interoperable, and reusable, which is exactly what DHCP is seeking to accomplish by making data more accessible, traceable, and reusable for computational analysis. And the federated privacy-first architecture essentially means using a federated model to protect the sensitive patient data. Under this model, the patient data remains local to the participating sites where it's generated, and it doesn't ever cross institutional, local, or provincial barriers. Each site handles their own data and users with complete control over who can access each data set. And for anyone who may be unfamiliar, very briefly, federated learning is essentially machine learning across these decentralized nodes to preserve the privacy of data by keeping it local at each site. In terms of DHCP's data ecosystem, we have selected OMOP as the international data standard that will allow DHCP to support diverse data types and build a system that speaks the same language, such as by standardizing vocabularies used across clinical domains, one example being disease codes. And to wrap this all up, you'll see in this timeline, first from the technology standpoint, by referring to the gray blocks, we can see that we have the platform's minimum viable product developed. And over the spring and summer, we will deploy the DHDP with the OMOP data model implementation and also continue user-informed software development. A sandbox environment will also become available for applicants to explore the workflows in the platform, and go live of the fully tested and functional platform is scheduled for January 2026, around when the projects would be selected for the Digital Health Innovation Fund. And we can see how this occurs in parallel with the request for applications process, as we recently launched and now are moving towards next steps, including the submissions of the expression of interest, letter of intent, and the full application submission prior to the project review committee selection of the projects. And all of the information that I've gone over for the technical framework and I will go over for the Digital Health Innovation Fund can be found on dhdp.ca. If you hover over the Funding Opportunities tab and click the Digital Health Innovation Fund, this webpage, I would recommend you bookmark it and revisit it to stay in the know and see when new documents are posted. So this page includes all the application documents, which cover the project eligibility, the funding opportunity, and the next steps, which I will go over in the next few slides. And the supporting documents covers more so of the data and technology focused material that includes the details on OMOP and the platform functionalities. And now I'll give a brief overview of the Digital Health Innovation Fund's request for applications before opening the floor to Q&A. And the purpose of this opportunity is to support the development of research programs through their use of the platform. So by identifying and selecting the research initiatives for their compelling science, projects will organically advance the design and use of the platform to support meaningful and impactful projects. As Jim previously mentioned, while the research focus is on oncology and neurology, applications focused on other areas of health AI research where similar data may be available will also be considered. And there is also a priority towards stimulating the collaboration between the small and medium-sized enterprises, the SMEs, while adopting a view toward the commercialization potential of research discoveries. At minimum, project teams are required to be composed of two representatives from 2 small and medium-sized enterprises. And in addition, projects must demonstrate access to the data necessary to carry out the proposed project. This would look different project to project depending on the use cases and what data is deemed necessary. And although public and private sector collaboration is not required, we do still encourage it to increase, if needed, to increase data availability. Projects should also demonstrate that they are technically and financially feasible, and they need to outline the pilot protocol with the regulatory requirements, for example, institutional privacy requirements, and also outline the data pipeline activities that would be required for the data provider to onboard the DHDP, and we would also provide that support on our end for onboarding the platform. And the project needs to be conducted in Canada, spanning a period of 8 to 12 months, and include plans for project IP and commercialization. So we have a $25 million funding opportunity through the support of DHDP's funder, ISED, and projects will not be awarded with grants, but rather we operate under a reimbursement model. And so there is a 20 to 25% reimbursement ratio for project costs, and this would be determined on a project-by-project basis. Reimbursement funds can be stacked with other federal, provincial, or municipal governmental assistance, provided that the collaborator does not exceed their maximum government assistance ratio. And this is detailed under the funding opportunity section of the RFA. I also wanted to inform potentially interested applicants about how we are leveraging DHGP's network to support matchmaking assistance in partnership with MedTech Plus's Beachhead network. We will work together to support applicants form project teams through our pan-Canadian reach to other SMEs, academia, and so forth. And this will be based largely on the project team needs, the shared research focus, and data accessibility. Ultimately, the Digital Health Innovation Fund is an opportunity with high value outcomes, being funding compelling research that advance research programs through the platform, building a data ecosystem, and DHDP will provide data providers with support for platform onboarding. And last but not least, fostering that network effect to build a collaborative network of researchers and innovators that really want to break data sharing barriers and bring research into reality. As for next steps, we have some key dates. They are not approaching anytime too soon. July 15th is when the expression of interest is due, and this can be completed by filling out the survey available under the application documents of the Digital Health Innovation Fund webpage. And in this survey, you can indicate if you would like matchmaking assistance. And then in August 15th, that's when the letter of intent would be due. And the expectation here is that the project teams would have been formed and there would be alignment on this project that would be submitted. And this would be kind of a collaborative effort to create this letter of intent. For now, you can refer to pages 6 to 8 of the request for applications for guidance on what the requirements are, and LOI documents will be posted in the coming weeks as well. September is when there would be an invitation for full applications sent out, and November 30th is the full applications deadline. And just a few last things. I have seen quite a few inquiries about membership, so wanted to address this here. And it will be included in the FAQs as well. Applicants are indeed required to sign the DHGP network member agreement to be eligible for funds, and similar to other collaborative networks within the scientific community, this would entail becoming part of a network that shares and supports DHGP's vision, mission, and goals. In order to simplify the process due to the high volume of responses, we have decided to embed the process of obtaining membership within the RFA process, meaning that with LOI submissions, which are not due until August, you will either need to confirm that you wish to pursue the membership or submit the actual agreement along with the LOI. And we will ensure the process is clear by posting the additional information in the LOI document and the FA document in the coming weeks. And benefits of DHGP are posted online under the membership tab, but I've also shortened list and put it right here. I also know that many might be wondering what is the best way to get your questions answered and stay in the know. So if you have filled out the expression of interest, by default, you will receive future communications related to the RFA. If you have not filled out an expression of interest or have questions, feel free to email dhdp@tfri.ca. Alternatively, you can fill out the question form under the Digital Health Innovation Fund webpage to subscribe or submit a question. And we have social media on LinkedIn. We just started a Blue Sky account, so feel free to follow us there too. And like I mentioned before, you can revisit the website to see when new documents are posted. And that concludes the webinar section of the meeting. You can now post a Q&A by going to the Q&A tab on Teams. So I don't see any questions created just
So
yet.
let me perhaps intervene here and just introduce a few key people. So you've heard from Ashley. Ashley is our program manager for DHTP. We also have on the line Adrian Thorogood, who is our data governance manager, and he splits his time in actually multiple ways with TFRI, including working with the Marathon of Hope Cancer Centers Network. And then we also have Ethan Huang, who is our software architect, and you have to remind me, Ethan, also our what's the term? we
Principal architect and lead strategy.
strategy lead. That's right, and I always get that wrong. And so this team and myself will try to answer your questions. We also, I think, have on the line. I believe it's. I mean, should have checked, but Amanda Maxwell, who is as a new member of the DHTP team and is handling communications. So if you want to, if you click on there's at the top of the screen, there's a Q&A button. If you click that, you can insert any questions you have, and I see there's a bunch of them now. So apart from the test from Ashley. So maybe we can start from the top. Maybe I think it's, I don't know which one was first, but I'll start from the top. Do data custodians have the authority to approve which projects can access or use their data on the platform? Yes, indeed. This is the security system and approach is very much accessibility is under the control of the data generators, but we also have guidelines for them. I don't know, Adrian, do you want to add to answering that question?
No, that's it. So the platform really gives a high level security and very granular control over access to the data provider side. So the user, what data, even what jobs can be run on the data. Of course, the idea is to support the project. So whatever access is needed in the project can be agreed upon, and then implemented in a very granular way on the platform.
There's one from Timmy Lee. Would building a new curated database of medical imaging for cancer application be eligible? In fact, yes, we were very much interested in these in the DHIF to support the ability of existing or in progress data sets to be compatible with DHCP. So as Ashley mentioned, for example, building in OMAP compatibility and working with us to ensure that there can be compatibility. So I would say that that's very much eligible. And let's see, Matthew Paquette asks, would a project involving two SMEs where a very big proportion of the expenses are incurred by a partner academic lab be eligible? Well, this is so the reimbursement model from us, from DHDP via ISED, is for 25% of the total part of the project. So if the SMEs were contributing through their own means, how the DHTP funds or funds from them are broken up in terms of the total project cost is up to you. But we'll work with each of the potential applicants to help you decide whether or not the project you're envisaging is feasible. We have quite a lot of experience in working with ISED through the CIF project and have a lot of understanding of the eligible and non-eligible costs, and there are all sorts of details around that. So we will certainly be partners in ensuring that as Ashley mentioned, the feasibility of the project makes sense within. Going down to Matvi Kipperstein, can you elaborate on what you mean by data provider within a content of the application for funds? A data provider here is essentially a group, could be academic, could be industry, private sector, that is building or has built a data set. So in other words, they have the authority either by decree or by the fact that they are acting on behalf of other organizations to be able to share that data. So they will need to ensure that they have appropriate consent, etc., because DHCP relies on assessment of consent, and of course the consent can be for only academic use, for commercial use, or whatever. But the data provider essentially in this terminology is the generator or the source of data which can be then accessed through the platform. I hope that's answered that question. Yeah, the recording and the PDF of the slides will be made available on the dhgp.ca website. Would United States-based organizations be eligible to apply either independently or in collaboration with Canadian partners? um, Maybe I'll hand that one to Ashley. Did you see that one,
Yeah,
Ashley?
no worries. No worries. We are looking into the certain conditions for international collaboration because DHDP is a platform that can be used nationally and internationally. But as for the RFA, there are certain conditions that will need to be met, for example, to protect patient data and IP that is generated as well. So we are looking into this, and for any I believe there's just a handful of inquiries we got for international collaboration, so I think they need to be assessed on a case-by-case basis, which I'm happy to reach back when we have more details.
So I think the next question is from Dustin Alice. And so on, in terms of Ashley's answer there, please do follow up. And it's much easier for us to be able to answer some specific questions if we know the particular context that you're thinking about. There may be some complications given the current situation in North America. So, but we'll work with you to understand your particular context. Dustin Arliss mentions it. His SME is seeking clinical data for spine surgery from hospitals. Would it be possible that this data could be available on the platform? It could be if those hospitals are willing to provide that. And and what we are hoping is that DHDP becomes a trusted platform for data providers and the data custodians to make that data accessible. So actually, your use case is exactly what DHDP is about. And the idea is it's disease agnostic and supporting both the data generators and through this funding scheme also to provide examples of how this sort of data sharing system can be most applicable, can be useful. So if you've got connections with hospitals, that may be good. And in terms of building up some sort of approach, but obviously it's not going to be much. DHDP wouldn't be useful to you if the data you are particularly interested in is not available. So again, we can work with you. And Martels asks, could you clarify the contributions required from the SMEs? It appears they can only recover 25% of costs. Can in-kind contributions count towards 75% company contribution? Let me see. Ashley, and we also actually have on the call George. George is Director of Finance, and so he may want to chip in on this one as well in terms of reimbursement eligibility.
Oh, yes. So regarding this DP, so I think as Ashley mentioned earlier, we are based on a reimbursement basis. And so Ashley would be so in the part of the agreement, we would be showing to you like all the what would be eligible cost and eligible cost to ensure that you get the right information as to like the actual funding you'll get. And in addition, like so all of the projects will be evaluated and you will be assigned like a reimbursement percentage for your project.
I think as well on this, Ashley mentioned a number of other funding sources are eligible to be contributing, but obviously you'll have to have captured those or have them in progress. And likewise, there is eligibility around the use of in-kind, of course, especially with companies who have already invested or are investing in some of the projects. In any case, to a similar end, then those costs can also be eligible. We have to assess that, and we'll be as transparent as possible in allowing you to understand, what part of the project can be covered through the DHDPIF. So Matt V. Kipperstein says, if we currently don't have a second enterprise SME, would you be able to partner up as part of your matchmaking process? Absolutely. And Ashley, I'll hand this over to you. Ashley mentioned some of the partnerships we've been generating.
Thanks, Jim. Yeah, for the matchmaking process, we have the expression of intents on our end, so we can kind of start putting the pieces of the puzzle together to see what potential project teams could form new collaborations with one another. So it really depends on the pool of applicants that we have, and we'll of course leverage our network as well as the MedTech Plus network to further our outreach. And we have quite a large network from the academia side, but then also we have the industry side as well. So we'll do our best to make sure that we have some strong matches and eligible project teams. But we also do encourage that if you have an existing collaboration or you have kind of collaboration in mind or go and seek one, then that's also a faster route to finding a suitable collaboration to form a project team with.
Thanks, Ashley. And as well, we're also working with the three AI institutes, Amy, Mila, and Vector, who also have pretty strong networks across Canada. A question from Aurora Maya. I'm sorry if I've screwed that pronunciation up. Can a department or unit operating under a large institution be classified as an SME, or does the size of the parent organization determine the classification? Actually, there is a definition which ICED uses. I think it's around 250 or less employees or FTEs or something like that. There is a fair amount of flexibility. Really, the idea is, I think, in terms of SMEs, it has to be a startup or it can be an established company, but of a given size. And again, beyond that, we can help to provide confidentially assessments of that eligibility. And if I'm correct, Ashley, I think even larger companies can become involved. Although, again, we do tend to go back to ICED to confirm that eligibility. So, for example, you may have a large company, but it's broken up into multiple semi-autonomous divisions, which actually behave more like SMEs. So, again, I don't want to generalize too much, but we can work with you in terms of determining that. I don't think it would really fly if there were two divisions of the same company as counting as two different SMEs. If they fall under the same board of directors, for example, that it probably wouldn't be eligible. Sanyu Lama says, two questions. How is the sandbox usage access early test process related to applying for the opportunity itself, and are they related, and can be mutually exclusive? I'm going to hand over to Ethan in a second, but this is, I kind of hate this analogy, but we are building this plane as we're flying it. But that was intentional in terms of we didn't want to build DHTP as a platform and do it without direct input from both the data generators and data users. So this is a collaborative program where you will influence the capabilities of DHTP. So we're hoping by taking that approach, you can help mold and correct us if we're omitting various capabilities. But let me hand over to Ethan, who can give you a more specific answer.
Yes, so the sandbox itself is basically available, I think, in the next couple of months. I guess it's before summer. That will allow the RFA or anyone interested to see how the DHTP platform works, and that also allows us to see whether we have additional requests from the user's perspective. So that's why the sandbox is available. I hope that answered your question.
So Ethan, I think as well, there's going to be, and this is going to obviously develop over time and be various releases and capabilities. It's really we're making this the intent is to make this available to help applicants help formulate their projects. In terms of,
Yeah.
if you don't know what the capabilities are of DHCP, it's going to be very difficult for you to make best use of it. So that's why we, again, are trying to ensure that as you construct your projects and your use cases, for example, that you get a sense of what is both available now and is going to be projected to be available by the time your project would actually start and the funding would begin. I've got a relatively easy question from Miriam. Thank you. Will cost from the private company be included in the eligible expenses for funding? Absolutely, it can be. So, for example, as Ashley mentioned, you could have an application. We could have an application coming from two SMEs with no academic involvement at all. If they're bringing data, that's quite feasible. And so they would be eligible for receiving ICED funds, again, through the eligibility filters that we'll communicate with you. Can we see on the website who has submitted an expression of interest? We would like to partner with small, medium enterprises as an academic lab. I'm going to pass this to Ashley. There's obviously issues here of competitiveness and confidentiality. I don't think with our survey, which is on the expression of interest website, I think we do say, we ask if you want to be on a partner. And obviously we can see all of the applicants, but I would also include, there may well be partners who have not yet expressed an interest, who may be interested, and we will connect through the networking. So, Ashley, do you have anything to add?
Yeah, absolutely. So we have the expression of interest still coming in. We'll have quite a few now, and I think the next steps is just to kind of remove the data that would not need to be shared publicly or shared when connecting and reaching out directly to say this is some potential co-applicant that you can form a project team with.
Yeah, I think in terms of what we would do is at the pre-competitive period, so before the actual submission, with permission from people who've expressed an interest, we will be happy to suggest contacting other applicants or other people who have expressed, or entities that have expressed an interest. However, of course, that doesn't, we don't want to prejudge anything from that perspective. But we will certainly try to make connections where we're requested to make those connections, and also we'll make suggestions where we have information which we think may be of use to you. Is AI-driven data control software for polymeric cardiovascular grafts well suited for an application? That's very selective and specific, and I think it's again, it's a question you're probably better to ask yourself. I would phrase it in: do you foresee a platform for a data sharing platform being of use? And I would say, and Ethan can certainly add to this. As Ashley mentioned, the network, the platform is based on federated distribution of the data. So in other words, if you've got because a lot of health data is behind the firewalls of the institutions, right? So it doesn't transfer. We do not have a central repository of the data. So we query the data through DHCP where it was generated and where it's being stored. And it can be then those queries, the results of those queries are consolidated again through the central node and returned back to the querier, right? So if you can envisage your data, or your data is most likely to be distributed among different institutions or sectors, and DHCP can help to access that, then your QC software could be very suitable. But I don't know your business model, and we're not trying to presuppose it either. We're also not being exclusive. So we do not. So, for example, there could be different data sources. We don't we're not trying to pick winners here at all. This is purely infrastructure. DHDP will provide various algorithms, platforms, tools, as well as data sources. But we are not excluding, or trying to avoid anyway, excluding different models and business models. Ethan, do you have anything to add to that?
No, you said it really well.
Okay, so just moving up. Sanju Lama, second question of out of the 25 million, what would be an average a PI, so a principal investigator will receive? I suspect the PI needs to be affiliated with an academic institution, not for profit. So again, you don't. We are encouraging interactions between the academic sector and the private sector. And obviously, the academic sector don't have resources other than through grants or other funding sources, and so are typically not able to bring cash to the table, and so would typically be recipients of funding, not necessarily. Well, the fraction of that funding in a particular project would be left to the applicants themselves. So we are thinking, though, the project size would probably from DHDP, right? This has to be matched then up, would be in the range of probably about $1 million to $2.5 million. Could be larger than that, but we really don't want to preclude larger or smaller projects. As I say, the total, if we take a reimbursement of 25%, there's the total project value for all of the projects would be at $100 million, right? So there's a lot of opportunity there for diversity of applications, and we'll have to adjust. Probably will give recommendations of the envelopes which would be applicable to apply for. We may, when we come to determining the which are successful and will receive funding, may choose to look at the budgets in terms of ensuring that we're covering as much variety and utility for extension of DHGP as possible. So that may come at the cost of, for example, if there are two or three very large applications, which preclude maybe 15 smaller applications, then we may adjust. But I think we will certainly discuss with the applicants if that was going to be the case. And it hasn't been decided yet because we don't yet know. We will know at the letter of intent stage the distribution of application budgets. So at that point, we may provide advice. If it's undersubscribed, then the budget limitations will also work the other way. We'll say that more money is potentially available. So you have to understand that we don't have those answers yet, and it really depends on the applications as they come in, which we won't know until August. So to clarify, DHDP is still not. This is from Brian Simmons, not operational until sometime 2026. As Ethan mentioned, there is a minimal viable product which has been generated, which has the components of DHDP, the baseline components, infrastructure is in place. That is being now integrated through Ethan's team and working with external contractors. But as he mentioned, there's a developmental process over the next 6 to 12 months, well, 6 to 10 months, which will add in additional capabilities and adapters, as it were. But we do expect that Ethan's team will need to work with applicants to help you ingest some of the software components, and to if you're developing, for example, tools for use to be able to plug into DHDP, then you will obviously need to work with Ethan's team. But yes, the intent is it to be significantly operational by the time of funding is released. Can a US firm, as is Uttara Sen, apply with a Canadian prime or Canadian lead. I believe so. Again, Ashley, you can contact Ashley or DHDP, whatever the where is it? We should have the link there. Sorry, that Ashley mentioned in the webinar. So we can answer those questions directly if you ask us specifically. Is there a minimum technology? What is this TRL level? Something. What's that? What is it, Ashley? TRL? Technology readiness level, is it?
Yeah, so I think I replied to that comment there.
Yes.
There is no requirement for starting off, for example, at TRL 5, especially because some of these projects will be completely new. But we do ask that the projects explain how the technology readiness level advances over time for their project and works towards the IP and commercialization.
So we've only got 4 minutes left, so I'm going to have to zip through these. But we will also post. We'll take your names off, but we will post your questions and add them to the FAQ with answers on the website by next week. There is also a French webinar which is going to be run in a couple of weeks' time, and that'll also be the information about that will be posted on the website. So in a situation where the data source is from Victor Agaro, where the data is currently not collected or available, can DHDP initiate the process of data collection? Potentially, however, that's unlikely given the timelines. So the project end is March 31st, 2027. So it depends, right? But you could use this as a means to an end, as it were. I don't think, though, that the DHDP fund is really about funding for data collection. That it really is about data aggregation and compatibility for data sharing. That's the proposed. Ashley, did you want to add to that? Or you were just coughing?
Oh, I think I was just typing. Sorry.
Okay. You got a noisy keyboard. Is there a preferred, this is from Paul Aurora, preferred number of SMEs? Greater than 2, better than 2? To be honest, no. I think I would say the answer to that is the appropriateness will really, it may well be that 2 is perfect. 3 may be a real pain in just dealing with different entities. So it really depends on the project. And I don't think there would be necessarily an advantage or disadvantage. That is actually for the applicants in the application process to make their case. And again, it's difficult to be general about that. What is the cost to become a member of DHGP? Oh, you'll like this one. It's 0. So there's no subscription fee to be a member of DHGP, and we'll work with you apart from the pain of going through agreements. But we'll work. We've got lots of partners already, lots of members already, and again, we'd be delighted to. There's no cost. It'll probably be adding to your email burden. That's all. You'll get a few additional emails from us, but we are again try to be light and nimble. So that was Sylvain's question. I believe from Paul Aurora, I believe you mentioned incentivizing commercial developments coming out of the funded work. Are there any IP considerations or guidance on IP applicants should be aware of? I'm going to hand to Adrian in a second. This is again very much in development, and again with IP. I would say, and this is maybe a little controversial, I would say that data per se, it's difficult to extract IP from data. It's really the analysis of that data, and we are looking at various models. But Adrian, do you want to be more explicit?
Sure. I mean, this is a complex part. I see the question as referring more to sort of the IP plans that the projects need to develop for the foreground IP. But yeah, so we certainly have a number of criteria that the program are trying to meet in terms of promoting the development of IP and the commercialization. and these have been, boiled down for the applicants as well. So I think the documentation does provide some guidance about what we would be looking for as high impact developments.
Yes, and if you've got, as Adrian mentioned, if you've obviously got your own IP, it would be important to be able to explain how that could be leveraged within the project. So I'm going to go very, very quickly the remaining because we're at time. If anybody wants to hang on, please do. We'll try and answer as many as possible. But I guess again, we will post the answers, and also the webinar recording will include the Q&A section. Can continuing care organizations act as data providers? So it's more specific to hospitals. Yes, the answer to that is continuing care organizations can act as data providers, and also the types that we're not limiting the types of data. It could be real world evidence, imaging data, genomics, clinical data, you name it. We're, again, data agnostic. That's really important, actually, because we do want to be intermodal for the data types. Riaz asks, can individuals of team size equals 2 participate, or is a company structure needed? I think we'll have to get back to you on that specifically. Typically, you'd have to be incorporated as a Canadian entity. So individuals are not equivalent to an SME, for example. But we'll get more information and answer that more fully in the FAQ. Does the data provider need, so from Nadine Akbar, does the data provider need to already have the data to be shared, or can there be plans to collect this data? Again, it depends on where you are in those plans. We're looking at large data sets, hoping for large data sets. And so again, timeliness is important. But in terms of feasibility and extensibility, if you've got a data set which is being built and you foresee it being expanding over time, then I don't really see why that would not be an advantage or not be applicable. But obviously, it would be even better if there's a significant amount of data which has been collected. Technical question from Sanju Lama. How would you anticipate a patient at hand benefiting from a federated database approach? Do you envisage each team or provinces securely interconnecting to the larger Canada or beyond database? So this is very much meant to be a research platform. Data accessibility for patients is a really important question, and something which we are considering in terms of what. So, for example, there could be an accessibility layer for DHDP, which would allow access to metadata, so you can see what sort of data is present, without having to undergo data access process. But I think this is a question. We have a patient working group working with our Marathon of Hope centers, and we are asking them questions about along these sorts of lines. What is the benefit for the patient? And so I don't have a good answer for that, but it's something which we are considering how best to accommodate. Scott Campbell says, can you apply to the fund using open source data? I believe so. I think, again, it's about how use cases, and so it's a mixture of different types of data, but you'd have to have to ensure that data wasn't being restricted in other ways. It would probably have to be flagged as well. Go on, get rid of that one. See, Riaz says, any idea of front-end technology to be used for this project? I'm going to pass that on to Ethan.
Yeah, we're pretty much open. Right now, the idea is to be cloud agnostic, framework agnostic, and everything. So I think we're pretty much open from that perspective. We want to leverage interoperability and anything that you can come up with so that you can do your work while we provide the data sharing platform and the solution behind it.
And Anne Martel asks, the timeline is very short for a scientific project. It is. So we're not really asking you to do a scientific project. This is really about how to pull together and integrate the various components, including the data, making sure that the pipelines, data analysis pipelines are in play. For example, it's not really meant to be a research project or a research grant in the conventional sense. It's really meant to be, in a way, an add-on. So you may have various components and would like to be able to have a mechanism to share data or feel that this is really important, but it's not meant to be to generate scientific results, but rather be a means to an end. I hope that's clear, because the timeline is short. You couldn't get a PhD out of this. Well, you possibly could. Homan al-Baghdadi asks, you said you're open to projects outside of neurodegenerative domain. Based on that, is the intent to approve a number of projects that are complementary to each other in terms of focus? And do you already have access to databases? So the answer there is, again, complementarity is not, again, we don't want to prejudge. It may well be that, for example, a cardiology database could very well be useful to combine or to be able to query along with, say, an aging brain health database, because there are obviously links. We don't want to presuppose that, and want to. I think the answer really is the more data, the better. And then the question you have is, in terms of access to databases. We do and we don't. We oversee, for example, the Marathon of Hope Cancer Centers Network, which has a lot of data. It's generated a lot of data. Some of it's still under embargo. And we do intend for them to be sharing data through DHTP, but we don't own the data. TFRI doesn't own any data. So again, it's a means to an end. This is a platform to access both existing and hopefully soon to be generated or to be shared data sets of different sorts. And I think that was the last one. And Thanu says thank you. Well, thank you, everybody, for persisting. And hopefully this was useful. And please check in with our website. Ashley will be posting an updated fact to include all your questions and hopefully, and also to elaborate on more of our answers. Any time frame for access to the sandbox with OMOP Common Data Model? Ethan.
Yes, so we are currently working with our tech partners. The first phase of the sandbox may include the OMOP model. However, it might be limited not to have the oncology extension or imaging extension, thing like that.
Yeah, thanks.
Again,
Thanks.
Yeah, again, I think we know. So as you can imagine, there's various priorities. The baseline infrastructure is primary priority right now, but again, we will be working with applicants in helping you to formulate your proposals, as well as once there is funding approved, there'll be continual interaction between Ethan's team and the various use cases, the various projects which are being supported. So it's an ongoing conversation, and there'll be collaboration between us and the applicants.
Yeah,
okay, Ashley, I think we should end the session now. Thank you very, very much again, everybody. Any other questions, please post them to the sources that Ashley posted earlier, and we look forward to interacting with you. Thanks very much.